Hi guys, welcome back to the Med Student Notes. Today I'm going to go straight into discussing methemoglobinemia and cyanide poisoning and how these values are affected. So I would really urge you to see the previous video if you haven't, because we've discussed the basics. We've discussed the structure of hemoglobin and we've discussed what PaO2 and SaO2 are, and you would really need to see that video to understand this discussion. So, coming to methemoglobinemia, see, in the normal structure of hemoglobin, we've discussed that we're going to have a ferrous ion in every chain of the hemoglobin molecule, which will attach to the oxygen, right? Normally. What happens in methemoglobinemia is this ferrous ion is oxidized into ferric ion. This can happen due to a number of different causes, like local anesthetics like benzocaine, lidocaine. Nitric oxide can cause this, nitroglycerin can cause this, isosorbide mono and dinitrate can cause this, dapsone can cause this, sulfonamides can cause this. So, these agents can induce this oxidation. We've discussed that the yellow smudge here is the ferrous ion, right? So, we're going to change that into a blue smudge to know that this has become the ferric ion. Now, the problem with the ferric ion is that it does not bind to oxygen properly. So, let's see what happens at the alveoli capillary interface. When you have oxygen entering here, your hemoglobin molecule is not able to pick up the oxygen. Because of that, the amount of oxygen that is bound to the hemoglobin is decreasing. Again, the oxygen that is dissolving into the plasma is the same, that's not going to change. But the amount of oxygen that the hemoglobin molecule is saturated with is going to decrease, right? Now, because this oxygen content is decreasing, because this hemoglobin is not able to pick it up anymore, your total oxygen content is also going to come down. And another thing that happens is, because this ferric ion is not binding to oxygen, the oxygen that is bound to the remaining ferrous ion, this ferrous ion is not willing to let it go. So, what happens is this bond gets tighter. Your hemoglobin is not releasing the oxygen that is already bound to it, also. And what will happen because of that? So, the hemoglobin molecule here, first of all, it doesn't have enough oxygen bound to it. Second of all, the oxygen that it already has also, it's not letting go of it. So, what will happen because of that? The tissue oxygenation itself will decrease, correct? So, when we go back to the table, what happens to the dissolved oxygen in the plasma? It's going to be the same. What happens to hemoglobin? The amount of hemoglobin is the same, that's not changing. Again, similar to carbon monoxide poisoning, the saturation of oxygen is going to be fixed at about 85% because the pulse oximeter is not going to be able to read ferric ion and the ferrous ion and everything separately. So it's going to be tricked into thinking that the saturation is about 85% when it can be much lower also. And we've also discussed that a total oxygen content is going to decrease because your hemoglobin is not able to pick up the oxygen and get saturated with it. And we've also discussed that the affinity of the oxygen that is actually bound to the ferrous ion is going to increase. So this is also not going to let go of oxygen, which will decrease your tissue content because your hemoglobin is not releasing oxygen already. Now, the discussion here is a little faster than the previous video because I'm assuming that we've locked in the basics in the previous video. And if you've understood the basics, everything that I've told you in this video is going to make sense very easily. Now let's move on to cyanide poisoning. We are going to talk about cyanide poisoning in a way that you'll never forget. Because do you remember that one friend that you've had at some point in your life who you thought was the sweetest person ever, and they always have the smile on their face and they're saying sweet things, but then later at some point you realize that this person had a conspiracy running behind your back the whole time? Cyanide is that sneaky friend. And I'll tell you why. In cyanide poisoning, your dissolved oxygen is normal, your hemoglobin is normal, and get this, saturation of oxygen is also normal, and total oxygen content is also normal. Crazy, right? Let's see how. Cyanide poisoning has happened. Your oxygen is coming in normally. Your hemoglobin is completely fine. Your hemoglobin is taking up oxygen normally. Oxygen is bound to it. It's traveling in the blood normally. Now, here, your hemoglobin is traveling in the blood normally, and what happens is it supplies oxygen to the cells, right? It supplies oxygen to your organs. Now, I'm going to isolate one single cell. We're going to take a look at one single cell. And we have the nucleus and we have the mitochondria. In the mitochondria, we have the electron transport chain. And I know the electron transport chain has made us all cry at least once in our career as biology or med students, but we don't have to get into it. All you need to know is in complex 4, you remember how oxygen accepts electrons and like ultimately we produce ATP, and that's how aerobic metabolism is done usually. Now, what sneaky little cyanide is going to do is block this last complex. It's going to block complex 4. Normally, inside complex 4 cytochrome oxidase, a ferric ion exists inside the ETC, inside mitochondria in the cell. This is different from the oxidized ferric ion inside hemoglobin in methemoglobinemia. That's completely different. Do not get confused. A ferric ion normally is there here. There is a reason I'm pointing this out, which I'll tell you later. And cyanide is going to bind to this, and this kills the last step of the electron transport chain, and your ATP is not forming. Your aerobic metabolism essentially is failing. So we have our oxygen here, we have hemoglobin supplying it, but your cell is not able to use it to generate ATP. So what will happen then? Your body is going to switch into anaerobic metabolism, and you're going to produce lactate, and there's going to be this acidosis in the body. But the blood itself, right? The blood is heavily oxygenated, but it's not helping out the tissues. Like the oxygen is not being utilized by the tissue properly, which is why you have a lot of oxygen in the blood, which is why your patient can actually look cherry red in cyanide poisoning. So you see why the oxygen saturation, the total oxygen content, everything is normal. The issue that's happening is the blockage of aerobic ATP production. It's kind of like having a fridge full of chocolate, but you're not able to eat the chocolate because your fridge door is sealed shut. And who's shutting the fridge door? Your cyanide. Let's take a quick look at treatments. For anemia and polycythemia, you'll basically treat the underlying cause. If anemia is being caused due to iron deficiency, you'll supplement iron. If the hemoglobin falls below 7, you'll transfuse. So basically treat the cause. Even in polycythemia, if the patient is very symptomatic, you can do phlebotomies. And if the cause is a malignancy, you'll address the malignancy, or the myeloproliferative disorder. You'll basically treat the cause. In carbon monoxide poisoning, you will give oxygen. You will give hyperbaric oxygen so that your oxygen knocks out carbon monoxide. It basically has to overpower the carbon monoxide. Okay? And in methemoglobinemia, we will give methylene blue. We've discussed that the cause of methemoglobinemia is this oxidation that's taking place, right? So when you give methylene blue, which is a reducing agent, your ferric ion will turn back into ferrous ion. So this will be converted back into ferrous ion if you reduce this with methylene blue. Now, the treatments of cyanide poisoning is where it gets very interesting. So here also you'll also have to give oxygen. Here also you'll give oxygen. Now the antidotes are, the most preferred option, the safest option is giving hydroxycobalamin. This combines with cyanide to form cyanocobalamin, which is basically like vitamin B12. And this is excreted in the urine. The other thing that you can do is give sodium thiosulfate. This gives sulfur to cyanide and it forms thiocyanate. And this thiocyanate is excreted renally. The third thing that you can do is give sodium nitrite or amyl nitrite. So we have seen here that these nitrites will induce methemoglobinemia and the formation of ferric iron, right? So look at how the issue in one thing can actually serve as the solution for the other thing. This is one of my favorite things about medicine. So here you're basically deliberately inducing a methemoglobinemia. Why? Ferrous iron in your hemoglobin will get converted into ferric iron. Now, you remember that I told you that cyanide will bind to the ferric ion here? So there's a lot of affinity that cyanide has for the ferric ion. So when you induce methemoglobinemia, cyanide will bind here. Let me make this very clear. You are inducing methemoglobinemia here so that your cyanide combines with the ferric ion in the hemoglobin, in your blood. So it stays in your blood and your cyanide is pulled away from the electron transport chain. We're basically choosing and inducing the lesser of two evils. We are keeping the cyanide trapped in the blood, combined to the ferric ion here, so that it doesn't go combined to the ferric ion in the electron transport chain and cause worse symptoms. So basically the lesser of two evils. But yeah, if you had to choose one, if you have access to hydroxycobalamin, this would be the best treatment to choose. So yeah, I really hope that you enjoyed this video because I really liked making it. So please do let me know in the comments if you liked it, and like, share and subscribe. Thank you so much. Bye bye.